Hi guys, let's answer questions, let's clarify questions of systemic sclerosis, that is systemic scleroderma. Doesn't matter, my beloveds, what question you have received in big exams, on your board exams. The core of the problem that you start with definition. It's a systemic sclerosis, it's a, I don't know, coronary artery disease, it's a gynecological questions, you name it. For example, these menstruation cycle disorders. You start with definition what is menstruation cycle, or surgical procedures, McMurphy sign, etc. Child-Pugh definition, etc. You start with definition. So if you know definition, so you know everything. Even if you forgot something, you will during the exams. I'm absolutely sure a professor will help you. So let's try to be specific from the beginning and start with definition. And then answering the question, of course. Systemic sclerosis, my beloveds, take your pens, papers and write it. It's quite rare, but happening. Chronic system, of course, rheumatic disease, autoimmune disorder, of unknown cause as any other autoimmune disorders, characterized by diffuse fibrosis and vascular abnormalities. Where? Scleroderma, in the skin, obviously. Then, joints, internal organs, especially the esophagus, lower gastrointestinal tract, lungs, heart, and kidneys. Common symptoms include Raynaud syndrome, polyarthralgia, dysphagia, heartburn, and swelling, and eventually skin thickening and contractures of the fingers. Lung, heart, and kidney involvement accounts for most death. That is heart failure, pulmonary failure, kidney failure, renal failure. Diagnosis is clinical, but laboratory tests support the diagnosis. No, sometimes. And 8, prognosis. Specific treatment is based on symptoms and specific organs involvement. About systemic sclerosis. So we know that what is scleroderma or systemic sclerosis. So it's the same thing, because systemic sclerosis is, we can put equal as scleroderma. No, a question of tradition. This hemisphere, ask question. We use definition systemic scleroderma. Doesn't matter. It's the same thing. Of course, it's an autoimmune connective tissue disorder. Connective tissue, the problems are there. Characterized by fibrosis, vascular abnormalities, and immune system dysregulation. This dysregulation is autoimmune disorder. So we have to understand that this pathophysiology is crucial for diagnosis and management, as the disease can affect multiple organ systems. Then, concerning classifications, systemic sclerosis classified traditionally in 2 main types: limited cutaneous scleroderma and diffuse cutaneous scleroderma. So limited means skin involvement distal to elbows and knees. Distal. Diffuse cutaneous skin involvement proximal to elbows and knees, including the trunk. What is clinical importance of that? Differentiating between subtypes helps sometimes, of course, predict the extent of internal organ involvement and prognosis. About pathogenesis. So the disease involves immune-mediated damage to small blood vessels. Then we have overproduction of collagen by fibroblasts. Chronic inflammation and fibrosis, of course. So what is clinical issue of that? That knowing that underlying mechanisms assist in targeting therapies and understanding disease progression. I know this is not very easy to understand. All autoimmune disorders actually is very interesting. So if you want to go into the science of medical science, if you want to obtain Nobel Prize, God bless you. So choose systemic disorders, autoimmune disorders. Concerning epidemiology, I don't know you will be asked or not, my beloveds, predominantly affects women, no idea why, 4-to-1 ratio, Peak incidence ages 30 up to 50. And so you have to be aware of no clinical importance. Awareness of demographics helps in early suspicion and diagnosis. What about skin manifestations? Because it's a scleroderma, well, so of course we start with sclerodactyly. Thickening, what is sclerodactyly? Thickening and tightening of the skin on the fingers. Raynaud phenomena, Raynaud syndrome, sometimes Raynaud disease. Raynaud phenomenon means vasospasm causing color changes in the extremities, especially hands and fingers. Clinical importance, be careful. Skin changes are often the first clue to diagnosis. We start with Raynaud very often. Not me, rheumatologists. Anyway, skin systemic involvement. So, as I mentioned above, pulmonary, interstitial lung disease and pulmonary hypertension, inexplicable. Actually, pulmonary hypertension is always inexplicable, in my opinion. Cardiac, myocardial fibrosis, arrhythmias. Not all arrhythmias, of course. Renal, scleroderma renal crisis. Gastrointestinal, what do we have? Esophageal dysmotility and gastroesophageal reflux. So you see, multi-organ involvement. That's why it's clinical important, a clinical issue. Multi-organ involvement necessitates comprehensive evaluation and monitoring. About laboratory and serological findings, no ANA positive in 95% of cases. Then anti-tropoisomerase I associated with diffuse disease, anti-centromere antibodies linked to limited disease and clinical importance, autoantibody profiling AIDS in diagnosis and prognosis. What about diagnosis, my beloveds? Clinical evaluation, skin thickening, Raynaud syndrome and systemic symptoms. Imaging, why not HRST, computed tomography, for lung involvement, then lab tests, serology, as mentioned above. Clinical importance, multimodal approach ensures accurate diagnosis and staging. Yes. Management. Actually, no management. We don't answer in this manner. But always the same fairy tale. Immunosuppressants, methotrexate, cyclophosphamide or cyclophosphamide, antifibrotic agents, nintedanib for lung fibrosis. If it's a Raynaud phenomenon, we use vasodilators. Supportive care, of course, physical therapy and symptomatic treatment. Treatment should be individualized based on organ involvement and severity. You will be asked about that. So what is clinical importance of all this? The treatment should be individualized based on organ involvement and severity. Not palliative management, actually. About prognosis, varies significantly with subtypes and extent of organ involvement. Means that diffuse scleroderma, systemic sclerosis, higher mortality due to internal organ damage. So heart failure, pulmonary failure, kidney failure, renal failure, and limited scleroderma, generally better prognosis. What is clinical issue? Regular monitoring and the multidisciplinary care improve outcomes. So that's all. I remarked that question that you misunderstood, and I tried to clarify these points. Thanks for your attention, my beloveds. Please follow and subscribe my Dr. Y YouTube channel, and don't forget to follow and subscribe my Telegram Dr. Y channel. This Telegram channel is private, of course. That's why it's a private channel. So how to find my Dr. Y Telegram channel? Why it's me, Dr. Y. So you tap in searching mode of Telegram Dr. Y, W-H-Y, like question, no? Without question mark, of course. Dr. Y, so we know Dr. Who, me and I'm Dr. Y. So you find this, it's a bot. You click start and you choose your plan. And you will find a lot of questions and answers like this, MCQ tests, question, answer, explanations, etc., 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 etc. Stay blessed. See you on my Dr. Y Telegram channel. See you. Bye-bye.